In phase 2 of the injury care guidelines, we're going to go over non-weight bearing exercises. You can start these right away after your injury because we want to increase circulation, but we want to help push the swelling out of the ankle. So we're going to do active range of motion, we're going to do some light stretching, and then we're going to do some very light non-weight bearing strengthening. Before you move on to this phase of your injury care guidelines, again, consult your physician or your medical provider before you start the exercises. You may not be ready to start the exercises that we're going to go over. This is the injury care guidelines phase 2, and you can download this, the non-weight bearing exercises, and follow along as we go through this example. All right, in phase 2 of the injury care guidelines, we're going to do active range of motion. You're going to experience some discomfort with this if you have a moderate to severe ankle sprain. If you have a mild ankle sprain, this probably won't bother you at all. Mild discomfort we don't mind. If it's sharp pains, then it's too much activity. Go back to phase 1 or talk to your healthcare provider again. So for active range of motion, to start getting some motion in the ankle, we're going to have our injured athlete push down and back up, and we're going to go through the ankle pumps. This is going to help by using the muscle pump in the leg to push that swelling back out of the ankle, and it's going to start progressing her range of motion in return. And go ahead and try some ankle circles for me. So try to go through your full range of motion. If it's too uncomfortable, decrease your range of motion as you're going through these exercises. The next step in phase 2 is the heel cord stretching. The calf can get very tight while you're having the swelling in the ankle. So what we're going to do is give Jenna a towel, and we're going to have her keeping her knees straight, pull straight back, again to comfort. You're going to have some mild discomfort. I don't want it to hurt, but we're trying to get a stretch up the back of the calf so we don't lose any range of motion in the ankle. She's going to hold this stretch for 30 seconds, and we're going to do this 3 times, each time she sits down to do it, which is going to be 3 or 4 times a day. After doing this stretch with the knees straight, we're going to switch, and we're going to bend the knee slightly, and we're going to do the exact same stretch because there's another muscle that goes into the back of the ankle called the soleus that we're stretching in this position. Same numbers, 3 times, 30 seconds each, 3 to 4 times a day. This is all still in the non-weight bearing portion in phase 2. Now the next thing we'll move to with Jenna is some active range of motion, but still non-weight bearing. I'll let you bend your knee for this part. And we're going to put your foot on the towel, and we're going to do ankle sweeps, and we're going to sweep in, pulling the towel in, and then we're going to sweep back out, pushing the towel out. It'll probably hurt more on the way in because you had a lateral ankle sprain. We don't want to go through the pain, you just want to go to discomfort, but we're trying to keep that motion, and we're trying to reactivate the muscles that are going to help protect those ligaments in your ankle. So reviewing phase 2, you're going to go through your active range of motion with the ankle circles and ankle pumps. You're going to do the calf stretches. You're going to do the active muscle motions of sweeping in and sweeping out. At the end of that, you're probably going to be sore, and you're going to return to the phase 1 instructions by doing your ice compression and elevation. You're going to get some minor pain and swelling after doing some activity. It's good to go ahead and ice again after that.